This sharing session focuses on drug-induced neurologic conditions. Pharmacist, as a drug expert, should be able to identify the drug that caused the DINC and to resolve this drug-related issues. Clinical conditions or diseases are due to several factors. For example, medical illnesses are caused by pathological factors. Psychological disorders or pseudo-diseases can be caused by psychological factors. Meanwhile, drug-induced neurological conditions are related to drug side effects or adverse effects. DINC can be subcategorized to several types, related to the syndrome or disorder, and the signs or symptoms presented as side effects or adverse effects. For example, DINC under cerebrovascular disorders are related to stroke and cerebellar syndrome, the usual presentation rataxia and nystagmus. Risk factors: DINC of cerebrovascular disease is high dose of drug and concomitant use of multiple drugs with similar side effects. Patient may show loss of coordination or balance. The possible mechanism include ion channel blockade, electrolytes imbalance, and vestibular toxicity. Example of drugs include lithium, anti-epileptic drug, and aminoglycosides. Another important syndrome is stroke. The mechanism include increased cholesterol and platelet aggregation. Example of drugs are estrogen or progestin therapy. Next, DINC is cognitive impairment and delirium. The risk factors include high dose of medication, concomitant illnesses, for example, elderly with mild dementia. The possible mechanism include anticholinergic side effects and sedation. Example of drugs that can affect the cognitive function are first-generation antihistamines, antiparkinsonian agents, skeletal muscle relaxants, tertiary tricyclic antidepressant, antipsychotics, and benzodiazepines. Neuroleptic malignant syndrome is another very important DINC. Initially, serotonin syndrome developed within a few hours after the introduction of the medication. An MS will develop after several days. An MS may be fatal. The mechanism include dopamine 2 receptor blockade at corpus striatum, spinal cord, and hypothalamus. Example of drugs that can cause an MS are first-generation antipsychotic agents, D-antagonist, and abrupt discontinuation of dopamine agonist. Next is movement disorders. The prevalence of drug-induced movement disorders is up to 50% in a form of Parkinsonism. The mechanism are dopamine receptor blockade and serotonin receptor agonist or antagonist. Example of drugs that can cause movement disorders include first-generation antipsychotic agents, dopamine antagonist, and abrupt discontinuation of dopamine agonist. Seizure disorders are among the common DINC categories. Majority of the patients presented as generalized tonic-clonic seizure. The mechanism include lowering the seizure threshold and increase excitation of excitatory neurotransmitters. Example of drugs that can trigger seizure include antiarrhythmics, antibiotics, antidepressants, antineoplastics, antipsychotics, mood stabilizer, analgesics, and withdrawal of selected drugs. Sleeping disorders or insomnia are also common DINC. The prevalence is about 40% of sleep disorders, especially among women and elderly. It's either having trouble to fall asleep, to stay asleep, or wake up too early. The possible mechanism include central nervous system stimulation. The example of drugs include anti-asthmatic agents. How drug-induced neurologic conditions should be managed. First, identify the causal drug. Look for exposure time and risk profile of all drugs. Second, removal of the offending agents. Third, manage the drug-induced neurologic conditions with appropriate signs and symptoms management. And lastly, close monitoring of the patient's conditions. Do not forget to document everything. It is hoped that with this sharing session, you will be able to understand better about drug-induced neurologic conditions. Thank you.